Today, October 13, let's start third week of professional practice and professional ethics class. Let's just go over review of last week. Last week we started psychotherapy falls into five broad different categories. Actually, these are five different categories are developed by psychologists, neuroscientists, neurologists, and psychiatrists. When we talk about this broad category, these are actually the method or the thesis of those names. You see the red text. These are actually psychiatrists, neurologists. They develop those theories and then the method of counseling. Okay, first it is psychoanalysis and psychodynamic therapies that is developed by Sigmund Freud. Maybe you guys have heard of Freud. Okay, and then other one is behavior therapy that's developed by Ivan Pavlov. Have you heard of Pavlov? Maybe you guys heard of it. And then next one is cognitive therapy that's developed by Albert Ellis, Aaron Beck. The next one is humanistic therapy that is also developed by Jean-Paul Sartre, Martin Buber, Soren Kierkegaard. Okay, last one is integrated or holistic therapy. That's actually not developed by certain psychologist or neurologist or psychiatrist. That's or combination or fusion of previous four therapies. Okay, they just borrowed good the aspect of four different therapies. Also, when we practice those five different therapies, there's always a basic fundamental method we should keep to counsel your clients. That is active listening. When you do counsel to someone, you have to do practice with this basic. That's active listening. Always you have to pay full attention to your client. That's very important. Also, empathy. Empathy is you have to put yourself to someone else's perspective. It's like, there's a word. If you want to understand somebody, you have to be in someone else's shoes, because everybody has different shoe size, right? So when you put yourself into someone else's shoe, sometimes it is too tight, sometimes it is too big. then you could understand, those persons' situation and problem. Also, active listening and empathy is very important. Also, when you do communication with your clients, you have to use a non-verbal communication. That's like, the body language. You use your body, motions, also facial expressions. That's also very important. The last one is open-ended question. Okay, always expect any answers, outcomes come out of the counseling when you do with your client. Okay, you don't actually need to drive, lead your client to a certain kind of, kind of decision or outcome answers you already made up. Okay, just make the answer is open. That is also very important. Okay, briefly, we want to go over psychoanalysis and psychodynamic therapies. That's founded by Sigmund Freud. That his theory says psychoanalysis is based on the belief, the unconscious thoughts, feelings, memories that influences our behavior and mental health. Have you heard of unconscious mind, right? Then, that is very important in his theory, unconscious mind. Also, a little bit of more explanation of our mindset. There are three parts of our mind. Okay, let me use this one. Okay. The first one is the conscious mind. I'm going to explain a little more. Conscious mind and the preconscious mind. The last one is unconscious mind. Our mind is composed of those three states of mind. Okay, then psychodynamic therapy is also developed by Sigmund Freud. Okay, that emphasizes the role of unconsciousness and the importance of early childhood experiences. You know that when you have, you don't know, but like the trauma you had when you are very young or a child, that affects your mind, and then sometimes that affects the rest of your life entirely. Okay, that's also very important to find out the early childhood experience. It could be good experience or it could be bad experience. Sometimes it could be trauma. So when you look at those things, you can find out the problem of your patient or client nowadays. Okay, and then that's the psychoanalysis and the psychodynamic therapy that's developed by Sigmund Freud. Okay. All right. Next. Also, you guys heard of behavioral behave, the action you do actually in your real life. The counselor try to see the problem in through your action and behavior. That's the behavioral therapy that is developed by Ivan Pavlov. You heard of Pavlov dog. Okay, let's say when you train your dog, you have pet, right? You give treat, and then when you give your dog a treat and you say, give me your hand, something like this, then the dog always, when you practice those things many times, dog remember, okay. Also Peter, dog think, I don't know, yeah, dog also think, dog is, he is trained to read with the word that I say. So even though when once you go through many times of training, then when you say to your dog, give me your hand, that means dog already knows. Okay, when Peter says, give me your hand, and then he is going to give the dog the treat, the food. So the dogs make the saliva in your dog's mouth. That's the behavioral therapy. Okay. Okay. If you see one more explanation, when you see the picture, okay, there are food, bear, and dog. Okay. You show your dog food first. Okay. Then you shake the bell. Dog hears it. Then the bell and food is combined. That's a fact to your dog. Then dog is responding. You practice those things many times. Now dog is used the bell sound. So when you shake your bell and the dog hears it, then saliva comes out of his mouth. Okay, that's the behavioral therapy. Also, cognitive therapy we use that is developed by Albert Ellis and Aaron Beck. Cognitive therapy emphasizes what people think rather than what they do. This is opposite of behavioral therapy. It is dysfunctional think that leads to dysfunctional emotion behavior. Okay. Because when you do certain kind of action and behavior, that always has a reason in your mind, right? When you think something, you do, your action is based on your thought, right? So this therapy is trying to catch what you think, what you're feeling, what your emotion inside yourself. That's the cognitive therapy. That's also known as cognitive behavioral therapy. First, focus on the thought, feeling, your spirit inside of yourself. Then, analyzes your behavior. That's the main idea of cognitive therapy. Right? Okay, this is just a review of previous class. Okay, cognitive therapy. First, focus on your thoughts, emotions that produce your behavior. So try to find out inside of your mind. Okay, that's the cognitive therapy. Also, another therapy we practice is humanistic therapy. That is John Paul Sartre developed that therapy, which is focused on client-centered therapy. We call that rejects the idea of therapists as authorities on their clients' inner experience. Okay, it is very similar technique or skill when you do a counsel. Okay, previously we talked about the open question, right? So this is very similar to open question. You don't need to make certain kind of outcome, certain kind of answer, certain kind of ending. It could be any ending. It could be any answer, because you always try to focus yourself to understand client's problem. So that combines your client's thoughts, behavior all together. Okay. It is also very in another word, there could be empathetic mind. Always you have try to understand someone else's, put yourself in someone else's position, someone else's situation, then try to understand your clients. That's the humanistic therapy. Okay, integrated holistic therapy, that is like I said, it is combined, fusion of all, good aspect of the therapy. It could be, behavioral therapy, humanistic therapy, cognitive therapy, psychoanalysis, psychodynamic therapy. You look up those things, you borrow good things, from those theories, then combine together. That's the integrative or holistic therapy. Okay, more deeply, more detailedly, we talked previously. It was skills and techniques. Okay. You have to practice a certain kind of skill and techniques when you counsel with your clients. Okay, that is just not talking, just not hearing. There are other than those things. Okay. Okay, psychoanalytic theory. It has a certain kind of techniques and skills. Okay. When you do psychoanalytic theory, Sigmund Freud, there should be always goal of your therapy to counsel with your client. Okay. First one is you have to help your client bring into the conscious and unconscious mind. Okay, I'm going to explain later. Okay, you always help the client walk through the development of a stage that was not resolved, where the client, becomes fixated. That means, okay, you are grown up. You are adult. I'm adult too, right? But when you live present day time lives, always, I don't know. Sometimes the experience that I had in childhood affects me in present day very much. Yeah. Like I say, let's say, okay, good example could be, okay, you have experience of resentment in your childhood. Okay, let's say when you are in elementary school, like 9 years, 10 years, you have on the stage and talking to people, many people, right? But you have bad experience of communicating with many people and yourself. Okay, when you say something, they laugh. They say "ooh," something like this, right? That's the experience you have in the childhood. So when you also, when you grown up as adult, you you put yourself into a situation you have to speak to many people, then your mind shakes. You say not clear or something like this. That affects your present behavior, thoughts. That's the so this is focusing on the previous childhood experience. Okay. Also, you have to have adjust the demand of your work, intimacy, and society. That's the goal of the psychoanalytic therapy. Okay. Okay, we have to use certain kind of techniques, pre-association. That is process where the client verbalizes any thoughts that made without censorship, no matter how they how tribal the thoughts, feeling that may be to clients. Okay, so let them say anything in their mind. That's also very important. Dream analysis also very important. Okay, maybe I don't know you have experience of dream analysis, but when you let's say when you look at the YouTube videos, sometimes you could find out that therapists practice dream counseling. That is, you fall asleep, right? And then the therapist talk to you in your dream. Okay, I'm gonna let's say I'm gonna count 3, then you fall asleep. Then client fall asleep, right? And when he is in sleep mode, he is still talking to your client, right? Okay, say, oh, now you in now.
The energy.
Yes, yeah. Now that's unconsciousness. So when you put your client into dream, then you say to your client, okay, let's go back to 10 years before now. Okay, what do you see? And then client says, oh, I see sky and the with green moon and grasses. Then I was playing with playing with my father and my mother, and I'm running. My father trying to catch me. Those kind of things. So the therapist, they try to find out in their dreams what the experience or what feelings they still affect your client's behavior or actions. Okay, that's also important. Okay, analysis of transference is a process where client is encouraged to attribute to counselor those issues that have caused previous experience is caused your difficulty with present life. Okay, the counselor helps client to gain insight by conflict and feelings expressed nowadays. Always focused on the experience we had before, actually when you're childhood. Okay, and then other thing is analysis of resistances. That is process where counselor helps client gain insight into what causes to form the basis of hesitation, of hurting of yourself. Okay. Then interpretation. That is actually analyzed. When you go through and finish counsel with your client, that helps your client gain insight into past and present event. Okay, not only focus on present event, not only focus on past event. You look up those two things and then analyze. Okay, here the explanation of your conscious, preconscious, unconscious mind. Okay, our mind has three parts. Conscious mind is we always know, recognize. Okay, see the iceberg T is above the sea line, right? So you always know in conscious mind, like I know what I say, I know what I act. That's always conscious mind. And then preconscious mind is, it's just below the sea level. It doesn't show in present time. But I am lecturing right now. But when you or student says to me, "Oh, professor, now we are getting to lunch time," then I feel like, oh, I'm getting hungry. That's preconscious mind. Okay? It always stays in present time, but you don't recognize. But you realize when somebody says something to you, oh yeah, I remember that. You have those experiences, right? And then when somebody says, food or car and whatever, movie star, I don't think of present time and right now, but when somebody said, oh, what is your, most favorite singer? Oh yeah, my favorite singer or rock band is like Beatles. That's preconscious mind. And then way below, that's the unconscious mind. Actually, we don't know what it is. It doesn't come up right away. Unconscious mind is the deepest and then the least accessible. It is very hard to find out what your unconscious mind has. Because as you see the picture, unconscious mind is deep below, right? When you see from the sea level, you cannot find out deep in the sea. That's what it is. It is very hard to find. It is, the least accessible to find out what it is. Okay, that's unconscious mind. Unconscious mind that has also thoughts, feelings, desires, memories that are hidden from conscious awareness. Okay, it could be controversial. Okay, I just heard. I just look at the document. She was a counselor. That's the lady, maybe 40 something. She was. She is client. She was counsel to her therapist. The topic was she is mid-40s, but okay, her situation, she is mid-40s, she has child, she has good job, she has husband, but the problem she has is she is dating other people. She is, when you look up the look at the person, she is like normal person, but she knows what the problem. Okay, because she cheat her husband, right? Then she find a counselor and try to solve the problem. And then when she's saying was always her present problem situation coming out of in the past. She is the only child when she grew up. Her father was professor. Her mother was professor too. Always their parents, educate her hard, train her hard. That was her, to her that was very stressful. Because I do study hard, because my mom was, pushing me too hard, or my parent, my father pushing me too hard. That's distressing. That's what she said. In normal life, she was very normal. She was good at teaching, but still she has, a stress in her mind. Yeah. So she, that leads to her, behavior in very bad way. Now, what she said was, when she cheated her husband, at that time her stress was gone. Yeah, I mean, yeah, that's why she knows her problem. Yeah, she tried to find,
We
find.
couldn't know a reason to.
I know, yeah, there's no reason, but sometimes, there are many, people we don't understand, right? So, yeah, I saw that, document. She was, yeah. So, that is unconscious mind. Her experience in her childhood, her parents always pushed her very hard, study too hard. That is stressed in her childhood. That affects your present life. That's the unconscious mind. So the therapist try to find out. It could be dream analysis, it could be anything. Try to find out what was problem, what was experience when she was young. Then, try to resolve the problem. So it is very important. Freud, psychoanalytic, psychodynamic therapy, this is the most important part. Find what was in deep mind. Okay, just also we have the mindset has three parts, right? Conscious, preconscious, unconscious. That's mindset. Also, your personality is different from your mind inside. Also, we have personality. Oh, okay. We say this word a lot. Oh, you have good personality, right? You have bad personality. Sometimes we use those things. Personality has three parts. First one is ego. And then the other one is ID. Then third one is super ego. Okay. The ID, okay, when you see the picture, this is sea level, okay? Ego is a little bit of, soft, preconscious mind together, unconscious mind. That's yourself, your personal ego. Okay, ego is, okay, let's go over ID first. The ID is in deepest part of your personality. ID is present at birth and is part of unconscious. Also, the ID is the side of pleasure, principle, the tendency of an individual to move toward for the pleasure or away from the pain. That's the ID. Okay, unconscious ID is unconscious mind. That's your part of your personality. You have good experience in childhood. That was good. That's also part of your ID. So I have good time with my father in the park, amusement park. when I was child. It was good experience. That makes me happy, makes me pleasure to go to amusement park nowadays. So you always try to, if you have time, you try to go to amusement park. That's your idea. And then the ego is second system of your personality that develop, and it is functions primarily in the conscious mind, okay? And then little bit of preconscious mind that serve as moderate between ID and the superego that control your ego, control your present mind, okay? Like, you wishes sometimes something, you desire something, that is your ego. So, the present yourself is your ego, okay? With behavior and thoughts. Okay, last one, the superego. That is kind of, that affects total of your ego and then ID, superego. Ego is composed of your conscious mind, preconscious mind, okay? That is your reality of yourself, okay? Nowadays, present time, that's the ego. Superego is like, kind of standard of your personality. Let's say, superego could be truth, okay? Let's say you always meet the people, you always talk to your friends, or your colleague in your job, you always talk to them with truth, okay? You don't lie to them, okay? You don't deceive them. That's superego. But real time, sometimes we do lies too, right? But you try to be this stage. If you are a normal person, okay? We talk about normal person. Sometimes I lie, then you regret, why did I lie to my friend, That's the personality of superego. So you try to be, not to lie to people. That's the superego. Or also, stealing something is bad, right? When you walk out on the street, you find $100 bill, right? Then you pick it up, put it in your pocket.
Donate.
Yeah. Then later, you regret it. Oh, why did I do that? If you're a normal person, right? Why did I do that? I just, take that money and then go to police station, or somebody dropped your $100 bill, or somebody dropped the wallet, I found it. That's the, that's the superego, right? The higher standard of your personality is superego. But sometimes we don't do that. I don't know why. Okay, individual psychology. That's another word. Client-centered therapy. Okay, that is developed by Alfred Adler. He is also very famous psychologist. Individual psychology is a psychological method or science that is founded by Austrian psychologist Alfred Adler. His method is involving a holistic approach to the study of character. Holistic approach is like this. Holistic means always let's say what could be there are forests of woods, right? Many woods. Holistic means you look up whole forest all together. That's the holistic. Not only focusing on certain tree or wood. Okay? If you look up when you are in forest, you always think of whole forest. Yeah, that's a holistic approach. When you counsel your client, not only focus on certain kind of character, certain kind of experience that they had in childhood. You always focus whole thing, experience in childhood, the thoughts, present times, personality, characters, all together. You have to consider those things. That's the holistic method. Because it is most influenced therapy in present time. Okay. Not only focus certain way or certain character, certain personality, certain experience. You put them all together and see the action and thoughts of your client. That's the holistic therapy. Okay, individual psychologist Alfred Adler is involving holistic approach to the study of character that has been extremely influential in 20th century counseling. Okay. The term individual therapy, psychology does not mean to focus on the individual. Okay. Not only focus on your individual, you have to look up the surrounding environment together too. Let's say you are talking to your client. You not only focus on the client's mind, experience, and the thoughts. You could try to find out, what kind of family do you have? Okay, you have many siblings, you have many brothers and sisters. Okay, always you have to look at those things, your surrounding. Okay, that's the holistic too. Okay, individual psychology focuses on understanding human behavior and personality through the individual experience, feelings, and then spirituality. Spirituality is like this. Let's say I like car racing. me, really, I really like car racing. Okay. Okay, I have very good. Okay, my friend called me. Okay, Peter, let's go out have a beer together. Let's have fun. But I don't go to bar because the car racing is gonna be on TV show 1 hour later. So no, I don't wanna go there. I wanna watch car racing. Yeah, that's the super reality of your character. Okay. All right. Let's have a 10-minute break and then individual. Okay, let's go over individual psychology. There are key principles and concepts. Okay, try to find out your superiority. That, like I said, I really like car racing. Even though I have appointment or call from my friend, oh Peter, let's have a drink at the bar. But I say I don't go. I don't want to go there because I have to watch car racing, sports game. That's the it could be anything. Like the superiority is you always put good value to the justice. Okay, yeah. If you think justice is most important part of yourself, okay, when you see injustice, you always someone else's injustice, right? You always talk to them. Okay, you always ask why you do that. Why you wanna give practice injustice. That's the superiority. Okay. Also, inferiority complex. Superiority is higher position. Inferiority is lower, position. Like inferiority means like you have always, let's say you have like moral, right? I always think of what is right, what is bad, or what is good, what is bad. Always you have in your mind what is justice, what is injustice. When you look up those things, you always put the justice is superiority, right? But at the same time, you put bad or good, you put it in inferiority. It doesn't. You have those things in your mind, but you actually don't care. You don't think, oh, I don't know. I don't care if it is bad or good. I do this because when you talk to your boss, that's not right. I mean, that's not justice. That's injustice. That means when you talk to your boss with, the matter of justice, then later the result, your boss put yourself into the hard situation, give more stress because you're telling him, boss, you're not justice. The result is your boss put yourself in a hard situation. That's not good for me, right? But you don't care because you put that, good, you put it in your inferiority, put it in lower value, right? That's inferiority. Because you put high value with justice, even though you are having a bad experience from your boss, you don't care. That's inferiority. Okay. Also, key concept is social interest. Okay. Personal psychology. You always, think the result of your action and thought and feeling. It is always benefit to the society too. Okay. Personal psychology not only focus on your individual. Okay. The result of counseling, it is always good to society. All right. The holism. Holism is, whole, not only focus on the individual's, certain aspect. You whole, you look up, you counsel, you talk to, you lead them to your client with, whole personal, whole mind, whole action. Put them all together. That's the holism. Okay. Also, birth order. That is also I'm gonna talk about later. Okay. And then lifestyle, psychological problems, encouragement. Okay. Okay. More key principles and concepts. Striving for superiority. Like I said, Adler believed that the prime driving force in human behavior is innate desire for superiority or self-actualization. That's the meaning of superiority. People are motivated to overcome feelings of inferiority and inequality and strive to reach their full potential. That is superiority. Inferiority complex, that is a concept of the inferiority complex, which is a sense of inequality or inferiority that individual may be developed or open in childhood, mostly childhood experience. That feeling can have significant influences on the person's behavior and choices throughout the life. They could be your childhood experience. Also, social interest. Adler emphasizes the importance of the social interest, which refers to an individual's innate tendency to connect with, contribute positively to the society. That's the social interest. Continue holism. Adler viewed individual as a holistic human being. That means many different aspects of the person's life, including your client's thoughts, emotions, behavior, social relationship, all those surroundings and individual. You put them all together. That's holism. And birth order. That's kind of interesting topic. that suggests someone's birth order with in your family, like for example, oldest child, middle child, youngest child. That could influence your personality development. You have brother, sister?
Yeah.
Okay. Eldest brother or eldest sister. You have two, right? You only
I
child?
am the single child.
You are you only child in your family?
No.
You have brother?
Just not directly brother. It's kind of my auntie.
It's a cousin.
A cousin?
Yeah.
That's cousin,
Oh,
not
cousin.
sibling. So you're only child in your family.
Yeah, only
Oh,
Yeah,
okay.
Only child.
Okay, let's say you have elder sister or brother.
Old.
You're
I'm
the
the
oldest.
youngest. Yeah, I'm the youngest one.
Are you the youngest?
Yeah.
Oh, okay. Let's say oldest brother have always responsibility, right?
Yeah.
Yeah. That
I think depends. you know.
depends, but
Yeah.
it depends personality,
Mhm.
character, but mostly parents
Yeah.
or you are, my first son. Okay, you always be successful because
Maybe
you have to take.
Asian culture.
Yeah, you have to also, Asian culture. You have to take care of your
yeah.
brother, sister.
Mhm.
That's the birth order.
Mhm.
Yeah. Okay, if you are an only child in your family, you always think only yourself. Okay, what is good, to me? What
Nice
is
to
bad to me?
share.
Yeah. I'm not judging you, but mostly that culture, the birth order is also that affects our personality. Okay, then the lifestyle. Adler introduced a concept of lifestyle, which refers to individual, unique way of viewing themselves, others, and then the world. A person's lifestyle is influenced by their early childhood experience too. Yeah. That's like I said before, early childhood experience, exactly what, we don't know what it is, but that influences present myself, right?
Mhm.
So, also that affects your lifestyle too. Okay, so see the picture in here? Yeah, first, middle, last, only child. Yeah. Second, responsible. Yeah. Yeah. First one, responsible. Motivated. Controlling. Right? First son, control. Okay, you take the order from your father, then you control your brother and sisters. Yes. And then if you see a middle one, okay, actually you don't take attention, right? I have older brother, I have a younger sister. We have 3 brothers, sisters, including me. I'm middle, okay? Always my parents focus on
First one,
my brother, older brother, and then
the youngest.
my younger sister. So, so I told myself, oh, my parents don't like me. Sometimes, I think that
The
is,
feeling.
yeah. But in the other hand, I am very free, right? I don't take the order, So I try to find myself, enjoy something else. That's left out. This. Nobody cares you because you are in the middle. My parents always care my brother, older brother, my younger sister. And then also peacemaker.
Peacemaker.
Yes. I'm peacemaker too. And social. Adequate. Adaptable. Adaptable means, you could put yourself in other situation easily. Yeah, that's adaptable. So yeah, these are the explanation of the picture. Okay. Birth order affects your personality too. Okay, that's the personal psychology. Okay, key principle and concept of personal psychology. Okay, psychological problems as standing means the big reason that affects your present yourself. The reason I don't know, but try to find out in counseling. Anyway, the reason, the stand, that is the more kind of motivation that affects your lifestyle and your on yourself. Okay, that leads to your thinking and actions. Okay, encouragement is very important too. Okay, in this therapy, Adler therapy provide encouragement and support to clients and helping them build self-awareness, develop a sense of social interest, and work toward their goals. Okay. Okay, stages of Adlerian group. I mean, when you counsel your client, there's a certain kind of stage you have to take. Okay, the first one is create and maintain good relationship. Okay, lying means put in another word, put the foundation for cohesive. Cohesive means it comes comes always with you, by your side, and then connect them together. Okay, stage 2 is analysis, assessment, explore individuals' dynamic. Early recollections as assessment procedure. Okay, then identifying the pattern of basic mistake. The stage 3 is awareness and insight. The gaining and insight interpretation done in collaborative way. Then the stage 4 is reorientation and re-education. There's a time for correcting faulty belief about yourself and life and others. At the end of last stage, you always correct the present yourself, and then your lifestyle, and then the view of for the others. So there's always correcting stages. Also that encourages to act as if. This one is act as if means, okay, now I am lecturing, and then now I am doing my job as administrator in this college. As if means put myself in some other different situation. Okay, other than I am in working in college. As if, okay, you are what if. As if means also what if. What if you are working in a manufacturing factory? That's what if. That's what. So when you put yourself in those situations, what can you do? What is your feeling? What is your outcome of your action and thoughts and feelings? That's the as if. That always try to be focusing myself to be better person. Okay. If you are politicians, or if you are, let's say, if you are as if you are pastor in the church, then in present life, how can you tell people lie, right? If you were pastor, you don't tell lie to people, right? So always, as if means put yourself some other situation. If you are in some other situation, you don't do certain kind of action, you do now, as your real yourself. Okay. Also, as if means if you have a lot of money, if you are rich, are you gonna still trying to steal other people's money? No, right?
Of course.
Yes, that's the as if. But in the present time, if you are not rich, but
Still cannot steal.
right,
Yeah.
yes,
It's the person is a human.
yes, that's what it is. Okay, the goal of Adlerian counseling, also psychology. It has two parts: healthy lifestyle and changing behavior. That's the goal. The goal focuses on helping clients develop a healthy lifestyle and social interests. The counselor assists the client through 4 goals of therapeutic process: establishing therapeutic relationship, examining the lifestyle, develop clients' insight, changing behavior. That's the goal of individual therapy. So the behavior change is the result of individual therapy. The outcome of personal therapy is not only change your mind, feelings, thoughts. With a changing of your mind, feelings, always they should be resulting good behavior. That's the outcome of personality therapy. So that means you become better good person. Okay, there are, I think this is the last part of today's lecture. Okay, in personal psychology, counseling, there are techniques. Okay, there are 7 topics of techniques. First one is confrontation. You have to face the real problem of yourself. That's confrontation. Okay, and then the question you have to ask yourself: why are you doing this? Why are you do certain kind of action? Why you behavior like this? That's the question. Okay. Then the encouragement. You have to find out good of your personality. Encourage. Okay. You are doing good in reading someone else's mind. Okay, or you're a good catcher. Yeah. So develop. Try to find out someone else's situation and problem. That helps relationship with other people. That also results of personal therapy. So also acting as if. What if? What if you're a doctor? What if you're a policeman? What if you are, professor? That's the as if. Splitting the client's suit. That means that a counselor points out the purpose of client's behavior. Always, when you act, when you behave certain kind of action, there are always reasons why you do this, right? So try to find out reason from the action. That's the splitting client's suit. Okay, catching oneself. That is helping clients learn to bring destructive behavior into awareness and stop it. That's simple. Like, for example, if you keep trying lying to your friends, your colleague, in your job, finally you're gonna lose relationship, right? That's catching oneself. So result of it is you stop lying to others. And then task setting. That is consisting of helping the client set short-term goals leading toward attainment of long-term goals. Okay. For example, let's say I keep lying to people. Okay. Then I counsel with my counselor. My counselor say, "Oh, Peter, just 1 week. Let's try. Just 1 week. Not to tell lie to others." Then I practice. Okay, I don't lie to others. I always tell the truth to people. Practice just 1 week. Then keep repeating, right? Then that practice change yourself. That's true person, trustful person. That's the task setting. Okay. This goal technique of this a goal of this technique is defining your lifestyle and help your client to gain, to see the real problem of your clients, and then this therapy borrows many techniques from other therapies. Okay. Personal therapy is more like more like personal therapy. It is more like integrative, holistic therapy. Okay. Not only focusing on certain parts of certain aspect of your personality or situation. You always put, surrounding individual, put them together. Then try to find out the problem and then the situation of your client, then help them resolve the problem. That's the technique of personal therapy. So you could borrow psychoanalysis, psychodynamic theory from those, therapy. You borrow good thing from them. Also, you borrow good technique from cognitive therapy. You could borrow from behavioral therapy. You put good things all together, apply to your personal therapy. That's the also good aspect of techniques of personal therapy and counseling. Okay. Yeah, I think that's it for today. Yeah. Now, we can wrap up. Any question?